My name is Dr. Shirish Gadgeel. I'm a thoracic oncologist, professor in Department of Internal Medicine at the University of Michigan. Today I presented a study on maintenance pembrolizumab in extensive stage small cell lung cancer. There are over 30,000 new cases of small cell lung cancer diagnosed each year in the United States, and about two-thirds of them have extensive stage disease. The median overall survival in these patients is only 9 to 10 months, and the standard of care for these patients of 4 to 6 cycles of platinum-based combination chemotherapy has not changed for the last 30 years. So we assess pembrolizumab, a PD-1 directed agent, as maintenance therapy, that is after patients had completed combination chemotherapy, to evaluate whether we could prolong or improve the progression-free survival in these patients. So patients who had completed 4 to 6 cycles of chemotherapy and had response or stable disease were treated with pembrolizumab. The primary endpoint was median progression-free survival. And the median progression-free survival actually was only 1.4 months. That means that 50% of the patients had evidence of progression of disease by the time they were due for their first scans. However, the 6-month progression-free survival was 21%. The median overall survival after starting maintenance pembrolizumab was 9.4 months, and the response rate was 11.8%, suggesting that even though maintenance pembrolizumab in the overall patient population did not appear to improve median progression-free survival, a subset of patients did appear to derive benefit. In an attempt to identify a biomarker that could define such a subset, we did assess tumors for PD-L1 expression. So tumor tissues obtained at the time of diagnosis were retrieved for PD-L1 expression. And we looked at PD-L1 expression both in the tumor cells as well as PD-L1 expression at the stromal interface. There were only 3 patients whose tumors had tumor cells positive for PD-L1 expression. But of the 20 tumors analyzed, 8 of the patients had evidence of PD-L1 expression at the stromal interface. And in patients whose tumors had evidence of PD-L1 expression in the stromal interface, the median progression-free survival was 5.5 months, whereas the median progression-free survival in the 12 patients whose tumors were negative for PD-L1 expression at the stromal interface was only 1.3 months. So it is possible that biomarkers like these can identify the subset of patients who benefit from a drug like pembrolizumab. So even though the overall patient population didn't appear to benefit, the hope is by defining proper biomarkers, we can identify the patients who do derive benefit and in the future use this drug in those particular patients.